So if science is right and addiction is really just an attempt to regulate a dysregulated nervous system, which it is, it's not a disease, it's not a disorder, it's definitely not a moral failing, then the metaphor would be if I had a giant wound on my leg, and instead of treating or healing the wound, I decided I'm going to start drinking or using or gambling or whatever the addiction is in order to soothe myself so I don't have to feel the pain of the wound as much, then that would be pretty close to what's happening. And that's fine until the numbing agent becomes the problem, until the solution becomes the thing that starts destroying people's lives. So traditionally, when things get bad enough, people will get into recovery, 12-step recovery or some other program where they stop drinking or using or gambling and their lives get better, and that's great. But here's what becomes the problem for a lot of people at this point. The wound is still there. There's still major dysregulation in the body and in the nervous system. And so once people get off their drug of choice, a lot of times they'll start addiction hopping, looking for other things that can regulate a dysregulated nervous system. But fortunately, in natural recovery from suffering, we're finding that there's basically an engine in our bodies called emotional repression that drives our dysregulation and suffering. That there are buried, repressed, disowned emotions that make us suffer unnecessarily. So why not go straight to that and resolve it, instead of for years sometimes trying to manage its symptoms? If this sounds appealing, visit repressiontest.com.